Hi, I'm Renee. It's nice to meet you. I teach Section 5 of N22. So, who am I? Well, I'm a nurse. I've been a nurse for 35 years. I started out as an associate degree nurse. I've worked adult med surg orthopedics. I have done pediatrics. And then for the last 25 years, when I was at the bedside, I did NICU. Once I came back here to school, I came back in 2015 for my bachelor's, 2017 for my master's. And at that time, I left the bedside to become both an academic educator and I also am an educator at the hospital that I work at, teaching professional nurses. Um, I'm also a student myself. I'm a DMP student. I have 2 more semesters to go. Woohoo! I can hardly wait. And I'm also a mom. I have 2 kids. I have a 30-year-old daughter and a 28-year-old son. And I am also the mom of a orange tabby cat named Elliot. So what are the goals for this class? Well, plan to work really hard. You're going to be learning some new advanced med-surg skills that will help you to be more successful in your clinical this semester. And we will have a special emphasis on sterile technique, CVAD dressing change, tracheostomy care, and Foley catheter insertion. We're also going to help you to become a more successful communicator, not only with your patients, but with your peers and colleagues as well. We're going to also help you develop those critical thinking skills that you've started. We want to expand those, help you to learn how to think on your feet. When things don't go right, how do you problem solve using critical thinking? We also will uphold you to professional nursing standards. They're high standards and they're foundational standards that are important and will inform your practice going forward. And most of all, we just want you to have some fun as well. We're back in the classroom, we're back together. This is a really exciting time for us. We're really looking forward to working with you in the lab. Be curious, ask questions. So, what are our expectations we have for you in the lab? First of all, you're going to be actively practicing in the lab. You are going to actively practice your skills to help develop your confidence in the clinical setting. You're going to practice speaking with your patients. Even though they're only mannequins, it's important to practice what you need to say while you're doing a procedure or a skill, and that helps you to become a more confident communicator in the clinical setting. And then we're also going to help you to develop and start thinking about a kind and empathetic approach to touch. Your first touch should never be clinical with a patient. We are going to hold you to the highest standards because our patients depend on us for their lives. So, now it's your turn to tell us all about you, or as much as you can tell us in a 3-minute video that you're going to upload to Canvas this week. Our platform that we recommend you record on is Studio. It's found inside of Canvas. And then also check the assignment section for the prompts that we recommend. You are allowed to do something a little different if you like, but just make sure you keep it clean and make sure you be proud to show your grandmother. Here's my contact information. You can text or call me anytime between the hours of 6 a.m. and 10 p.m. You can email me, of course, anytime, but expect a 24 to 48-hour turnaround time on emails. And here is your course point code for Section 5. Really looking forward to seeing you guys in the lab. Have a great first week, and I'll talk to you soon.